Forum, and it lends me immense pleasure to wholeheartedly welcome you all to end this insightful webinar on the global career opportunity for pharmacists, unlocking opportunity in Australia, New Zealand, and Canada. And we are deeply honored and humbled this morning by the presence of Dr. Dipendra Singh, Chairman, Education and Regulation Committee, PCI, Delhi, as a chief guest of the day. Sir, your presence here today is awe-inspiring and extremely gratifying for all of us. And your prophylactic aura will definitely motivate us motivate the student in their academic journey. And I wish to convey all the participants whosoever is joined here. And he is such a dynamic persona, although he is traveling and attending some another meeting, and he has kind enough to give his consent to be with us. Thank you so much, sir, for being always there for us. Thank you. And we are deeply honored and humbled by the presence of Dr. Manju Rawat Singh, the chairperson, IPGA Women Forum. Ma'am, your presence here widens the mental horizon and will leave the students more motivated and determine their journey ahead. I'm also grateful the presence of today's speaker, Mr. Arif Muhammad and Ms. Haraika, accredited consultants and pharmacists from Australia. And it's really appreciated that you are both are motivating the students and providing.
Ma'am, please unmute yourself.
Not audible, Rona.
Oh, okay. Sorry. So sorry. So, a very warm welcome to all of you. I, Dr. Vannagar, co-chairperson of IPGA Women Forum. And it lends me immense pleasure to wholeheartedly welcome you all to this insightful webinar on global career opportunity for pharmacists, unlocking the opportunity in Australia, New Zealand, and Canada. And we are deeply honored and humbled this morning by the presence of Dr. Dipendra Singh, Chairperson, Education Regulation Committee, PCI, Delhi, as a chief guest of the day. Sir, your presence here today is awe-inspiring and extremely gratifying for all of us. And your prophylactic aura will definitely motivate the students in their academic journey ahead. And I wish to convey all the participants here, whosoever is joined, and he is such a dynamic persona. And although you are saying that he is traveling somewhere and attending some another meeting, and still he has kind enough to give his consent to be with us today. Thank you so much, sir, for always being there whenever we needed your support. And we are deeply honored and humbled by the presence of Dr. Manju Rawat Singh, the chairperson, IPGA Women Forum. Ma'am, your presence here widens the mental horizon and will leave the students more motivated in their academic journey ahead. And I'm also grateful for the presence of today's speaker, Mr. Arif Muhammad and Ms. Haraika, accredited consultants and pharmacists from Australia. And I'm also thankful to Mr. Rakesh Khan, who has given this platform to motivate the student to pursue their career in the different countries. And it's really appreciated that you are motivating the student and providing the guidance how they can pursue their career as a pharmacist in Australia, New Zealand, and Canada. And I also welcome the bright and prominent minds, Dr. Ramanpreet Walia, North Zones Coordinator, IPGA Women Forum, and Dr. Geeta Deswal, Dr. Anjali, coordinators, organizing secretaries for putting extra efforts to make this webinar happen and to a grand success. So we have more than 800 participants who has joined us today. And lastly, a delightful welcome to all the participants. And this webinar will cover the global opportunities and detailed insight into the scope of pharmacy practice in different countries like New Zealand, Austria, and Canada. And this seminar will also provide the comprehensive information about the qualifying exams required for pharmacists in these countries and detailed guidance for migration process. I'm not taking much time, so I think all the participants will be benefited by listening to them and would excel their career as a pharmacist in different country. So over to you, Anjali. I'm not taking much time. Thank you so much.
Thank you so much, ma'am, for the warm and heartfelt welcome. Thank you, ma'am. Now, I would like to request our Honorable Chief Guest, Sir, Dr. Dipendra Singh, to bless us with his words of wisdom. Sir, please.
Thank you, Anjali, and indeed a pleasure to be with you all on this online platform. And, I'm very thankful to you all that because this effort is very continuous, and the IPGA Women's Forum, you have made something that is you're putting extra effort in this, and this time you have selected a very good topic, which is much concerned with the career of the students who are willing or who are inspiring for the to work as a pharmacist or to work abroad as a pharmacist. Though I would like to, at this time, I would like to say that again, I say that we'll make our profession through, like, our student will not move outside India. But indeed, good effort by you all. And I'm very thankful to the forum and the coordinators all, Dr. Vanna, who is always much humble. And though I always say that I'm also learning, and nothing like that you people are saying. But again, what I wish to say that be proactive, always move ahead and try to get what it is going on. This is the time of change, and we are, if you want to make pace with the changing scenario in technology, and specifically when we are moving so fast in that area, that few months back we were talking about some AI will come and AI will make the changes, and within 6 months the AI is in every hand and we are using the technology wisely. So again, on every forum, I'm just requesting everybody that this technology is very good till you are using it as a tool or using as your weapon, not becoming the slave of the technology. So my humble request to all the students who have joined, that use the technology wisely and be the master of the technology. Don't be slave of the technology. So again, I know that there are some speakers are there and students are willing to listen to them. And I'm also rushing to another program. I'm in car. So thank you for inviting me in this function. My best wishes to all of you that you will continue this good work. And I am very sure that IPGA Women's Forum, within a very short span of time, you are visible everywhere. And I'm very sure that you will be one of the best women's forum in the country and in the world also. Thank you so much.
Thank you so much, sir, for sharing your insightful thoughts with us. And we truly appreciate your time and guidance, sir. Thank you so much, sir.
Thank you so much for joining today, sir.
Now it's time to introduce our expert speaker from Elite Expertise. We are privileged to have with us Mr. Arif Mohammed, a seasoned professional in the field, and Ms. Harika, a renowned expert in the career development for pharmacists. Their insights will surely guide us to inspire the explore global opportunities in the pharmaceutical world. Arif Mohammed, sir, is Director of Elite Expertise and he is currently practicing as a clinical pharmacist at Northern Health Hospital, Melbourne. Mr. Arif Mohammed is renowned for his excellent teaching skills and practice-based experience, which can contribute to the developing practice-based knowledge for a learner. He has been practicing pharmacist in Australia for the last 5 years and has been a preceptor of several students and intern pharmacists. He is accredited consultant pharmacist in Australia and proven expertise in conducting home medication reviews and medication management services, contributing to positive pharmacist intervention to reduce medication misadventures in community and hospital settings. I welcome you, sir. He is also a pharmacist immunizer in Australia and a member of SHPA, that is Society of Hospital Pharmacists of Australia. He finished his post-graduation in India in the year 2012 and moved to Malaysia, where he worked as a hospital preceptor and university lecturer for 4 years. His interest to advance in clinical expertise led him to the pathway of being an Australian pharmacist. His sound knowledge and therapeutics and pharmacy practice reflect his teaching. It's our privilege to have you with us, sir. It's now over to you, sir. Arif, sir.
Yeah, thank you so much, Dr.
Our
Anjali
pleasure
ma'am.
that you are with us. I welcome you, sir.
Yeah. Thank you so much, ma'am. Thanks a lot. Thanks for giving such a nice introduction. So at first, I would like to appreciate all the members, all the team members for organizing this event. Okay. So first of all, my special thanks to Dr. Deependra Singh, who is the chief guest of this event. But unfortunately, Dr. Deependra is not available in this event, but still he gave a very good message to us. So he gave a very strong message to us, and I have been like, I know him, I know about him from many years, but today I have seen him in and I got a chance to listen his words, okay? And he gave a very good words for our students, especially those who have already graduated and those who are looking for the opportunities in overseas and so on. And also special thanks to IPGA Women Forum members, Dr. Manju Singh, the chairperson, Dr. Vandana ma'am, who is already here with us, and Dr. Ramanpreet Walia, and for Dr. Geeta Teswal. So for all the members, I would like to thank you for organizing this event. And I'm sure that after this event, all our students as well as the graduates, so whoever they are attending these events, they will get benefited out of it. So I would like to give you a short presentation about how the pharmacy practice, the scope of pharmacy practice will be there in overseas. So I just want to share a slide, and I would like to go from there. So I hope everyone can see this slide. First of all, special thanks to all the members. Special thanks to our chief guest, Dr. Deependra Singh, and to all the IPGA Women Forum members who are here with us. So first of all, my name is Arif Mohammed, and I'm one of the directors and educator at Elite Expertise. So Elite Expertise is an online platform, so which helps all the overseas pharmacists in clearing their licensing examination, either if they are planning to migrate to Australia, New Zealand, US, UK, Canada, Ireland. So for all these countries, so we are helping the candidates to achieve their targets and to reach to their dream countries. So we started Elite Expertise last year in 2023, and at first we have started by providing the training for Australian CAPS examination, and we have been like getting a huge success rate. We have been showing a huge success rate in the market. So far at Elite Expertise, the success rate is up to 94%, and we started by training for CAPS examination, and later on we also introduced the training for intern pharmacist in Australia for intern written and oral exam as well. Okay, so those things that I will go in detail in the next upcoming slide. And myself, Arif Mohammed, and my other director, she's Harika Bhimavarpush. So I'm working as a clinical pharmacist in Northern Health Hospital in Melbourne, and she's working as a clinical pharmacist in Monash Hospital in Melbourne. So before I want to discuss a few things, I just want to share my journey, how I became a clinical pharmacist here in Australia. So actually, I did my bachelor's and master's in India. So I completed my Master of Pharmacy back in 2012. And after completing the master's, then I got an opportunity to work as a clinical lecturer in Malaysia. So I moved to Malaysia. I was in Malaysia for 4 years, and where I worked as a university lecturer. And after that, I took the licensing examination for Australia and I cleared that exam. And I moved to Australia. I moved to Australia in 2018. And soon after moving to Australia, I did my internship in community pharmacy. And after completing the internship in community pharmacy, I entered into hospital setup, that is as a clinical pharmacist in the hospitals. So for the last 5 years, or for the last 5 to 6 years, so I have been practicing as a clinical pharmacist here in Australia. And at the same time, I also completed my accreditation, and currently I'm a accredited consultant pharmacist as well. So which means that I will be providing the advices and consultations to the doctors regarding the patient's medication therapy. So where I will be doing the home medication reviews and the residential care medication reviews, and I'll be giving the advice to the doctors regarding the medication therapies and what changes that to be done to the patient's medications. So these are the courses that we are offering at the moment. We are offering the CAPS exam essential course. So CAPS examination is the one that all the overseas pharmacists that they need to appear, that they need to write at first. So then now, but from coming March, they are going to change the CAPS exam to OPRA exam. So which I will explain you in detail in the next upcoming slide. And also we are providing the training for intern pharmacist written examination and intern pharmacist oral examination. So how does it work? For any person, especially whoever we study in India, so for the Indian graduates, in order to become a pharmacist in Australia, so at first we need to sit for this CAPS or the OPRA exam. So that is just the overseas, that is known as the overseas pharmacist screening exam. So it's just the screening exam. So at first we need to clear that exam. And after clearing that exam, so we need to start doing internship. Internship will be for 1,575 hours in Australia. The same thing goes in New Zealand as well. So we need to do the internship. And during internship, there will be 2 more exams. One is the written exam and the other is the oral exam. So after we clear all these 3 exams, that is the first CAPS exam, then written exam, then oral exam. So after we clear all these 3 exams, and once we finish the supervised intern hours, then we will become a fully licensed pharmacist in Australia. Okay. So this is the pathway. The 3 exams will provide you the complete license to become a pharmacist in Australia. So here at Elite Expertise, we started providing the training with the CAPS exam and intern pharmacist written exam, as well as the intern pharmacist oral exam. And recently in July, we also launched the program for the PBC for Canada. So whoever they are planning to migrate to Canada, they need to write the PBC exam. So again, in PBC, the same 3 exams will be involved. The first one is the evaluating exam, which is similar to the CAPS or OPRA exam in Australia. Then the second 2 exams will be the qualifying exams in PBC. That is, one will be the MCQ qualifying, and the third one will be the OSCE. That is nothing but similar to oral exam in Australia. So total 3 exams, which will give you the full license to practice as a pharmacist in Canada. So we started training the students for PBC as well. So this program has been started recently in July, and our current batch of the PBC is ongoing. At the moment, we are also providing the training for the interns. So 50+ interns are getting trained at Elite Expertise. So which is nothing but these are the candidates. They are getting the training for the intern pharmacist written as well as for the intern pharmacist oral exam to get their final pharmacist license. So 50 plus more than 50 candidates are getting the training at Elite Expertise. And this is our success rate. Actually, we started our first batch in July last year in 2023. So in 2023, our success rate was in July 2023, we achieved 90% of the success rate, where around 89 candidates, they have cleared the exam from Elite Expertise. And our second batch was in November 2023, where 94% was the success rate. Total 99 candidates, they have cleared the exam from Elite Expertise. Then our third batch was in March 2024, this year, where 121 plus candidates, they have cleared the exam. And our fourth batch, the last batch, was in July 2024, where 130 candidates, they have cleared the exam from Elite Expertise. So we can proudly say that Elite Expertise is the only platform where a huge number of the candidates, they are able to clear their exam in their first attempt. And all these candidates, whoever they have cleared the exam, so more than 50% of them, they have already started doing the internship. So whoever here in Australia, so they have already started doing their internship. And yeah, regarding this OPRA exam, so as I mentioned, that the first exam that the candidates, they need to clear initially is the OPRA exam. So this OPRA exam, they are going to start from March 2025, that is from coming March. It is known as the Overseas Pharmacist Readiness Assessment. So till now, even for the coming November, the exam that Australian Pharmacy Council is going to conduct to overseas pharmacists or to overseas candidates is known as the KAPS, CAPS exam. And in CAPS exam, they mainly assess the knowledge of the candidates, mainly about the pharmaceutical science knowledge. But in OPRA exam, they are going to change it a little bit. So they are going to change the pattern, and they are going to change. They also made the change in the syllabus and so on. So, and this OPRA exam, they have designed in such a way that the overseas pharmacists, they should have that equal knowledge, not only the knowledge, and also the applicable skills similar to that of the Australian graduates. So they have designed this exam in such a way that they are testing not only the knowledge of the candidates, but also they are going to test the application skills of the candidates, especially when it comes to the pharmacy practice or to the clinical skills. So they are going to assess the clinical skills of the candidates in OPRA exam. So this is the change that has been done by the Australian Pharmacy Council. So from March 2025, they are going to implement this change. And this is about the OPRA exam. And what are the steps that are involved for the candidates to write this OPRA exam? So at first, they need to undergo their document evaluation. So they need to undergo their document evaluation, where your transcripts, your university degree transcripts will be assessed by the Australian Pharmacy Council. And also they will assess your license. So when you get graduated, so you will get registered in India as a pharmacist. So that pharmacist license will be assessed, and your passport and the other few documents will be there. So when you submit all those documents and you make the payment for the Australian Pharmacy Council, then the Australian Pharmacy Council will assign a case officer, and the case officer will go through all those documents, and the case officers will do the assessment, and the case officer will give eligibility to sit for the exam. And this whole process, it takes around 6 to 8 weeks time. So after within 8 weeks time, the case officer will give you eligibility to appear for the exam. Then at first you need to appear for this OPRA exam from March, because now the deadline for the November is already completed. So which means that from next year, 2025, so at first you need to appear for this OPRA exam. And after clearing this OPRA exam, you need to start doing the internship, and also you need to clear the 2 other exams, which I have mentioned, that is the intern written and the intern oral exam. Now, so this is the change that they made in the OPRA exam, which is going to be held from the March 2025. So this exam, the Australian Pharmacy Council is going to conduct 3 times a year. So it will be in March, then it will be in the July, and also in November. So it will be 3 times a year. And these are the core subjects that they have included in this OPRA exam. So one is therapeutics and patient care, so which carries around 45% of the component, and pharmacology and toxicology, which carries around 15% of the component, biomedical sciences, which carries 20%, medicinal chemistry and biopharmaceutics, 10%, pharmacokinetics and pharmacodynamics, 10%. So these are the core subjects that they are including in OPRA exam, which is going to start from March 2025 in Australia. Then, now coming to the global opportunities of the pharmacist. So pharmacists have a very good opportunities, especially if anyone is planning to migrate to the Western countries like Australia, US, UK, Canada, New Zealand, Ireland. So in all these countries, the opportunities for the pharmacist is like they have a very good opportunities to practice. So I will give you a few examples as well in the next upcoming slide. So what is the main scope of a pharmacist in Australian pharmacy practice, and what is the scope of the pharmacist in Canada or in UK, US? So in all these countries, like I guess when we are studying in our Bachelor of Pharmacy, or when we are doing our masters back in India, so we might have studied, like we know that already we have studied that in overseas, especially in US, UK, Canada, Australia, in these countries, pharmacists, they will have a very good scope, and very good scope in the sense mainly when it comes to the practice. Okay? So as it is true, I haven't realized that the pharmacist will have such a huge opportunity or such a huge scope in Australia as well as in Canada and other countries. I realized it only after landing here, and when I started practicing as a clinical pharmacist here in Australia, then I came to know that how doctors, they are completely dependent on pharmacists. Okay? So how the doctors are dependent on the pharmacists. So without a pharmacist in the hospitals, without a clinical pharmacist in the hospitals, so usually it will become a very difficult task for the doctors to manage the therapy. So clinical pharmacists in the hospitals, they play a very important role that I will explain you in detail how it's important or how significant the clinical pharmacist role is in Australian pharmacy practice. So in Australia, in order to become a pharmacist, the candidates, they need to appear for the CAPS, or the latest exam that they are going to change is the OPRA exam. And once they clear this OPRA exam, then they need to do the internship and clear 2 more exams, and they will get the license. The same goes with the New Zealand as well pattern. So the same goes with the New Zealand as well. In New Zealand, again, the same exams as the CAPS or the OPRA exam. And even for the New Zealand, Australian Pharmacy Council will conduct the exam for New Zealand. So the exam, it remains the same for both the countries. For Australia and New Zealand, the exam is the same, that is the OPRA exam. And for US, the exam is the NAPLEX. Okay, so NAPLEX pathway. So we need to go with the NAPLEX in order to clear, in order to work as a pharmacist in US. But unfortunately, to work as a pharmacist in US, we must have PharmD degree. So Bachelor of Pharmacy is not acceptable in US. So we must have a PharmD degree in order to appear for the NAPLEX exam. Okay? And Canada, the exam is the PEPC exam. And for Canada, we can appear with our Bachelor of Pharmacy. In Canada, they will accept the Bachelor of Pharmacy. So even the Bachelor of Pharmacy or the PharmD, anyone can appear for this Canada exam. Australia as well, the same. Even in Australia, either if you are a PharmD graduate or if you are a Bachelor of Pharmacy graduate, so everyone can appear for this Australian exam. And UK, the same, OSPAP. Even for UK, Bachelor of Pharmacy, that is the 4 years Bachelor of Pharmacy, is acceptable. So they can appear for this OSPAP, and they can become a pharmacist in UK. But Ireland is different. Ireland PSI exam, it demands the PharmD. So US and Ireland. So these two are the countries they need the Form D to practice. But all the other countries, they don't need the Form D. So just the Bachelor of Pharmacy would be sufficient. And when it comes to the practice, so that's the most important one. Now we are discussing about the pharmacy opportunities and how the pharmacy practice will be there in these countries. So when it comes to the pharmacy practice is well advanced and it is well developed in all those countries. Okay? So there is countries like in Australia, US, UK, Canada, New Zealand. So in all these countries, the pharmacy practice is well developed. There is nothing but the pharmacists, they will have a high value, okay? And the pharmacists will they will get a good respect as well in the community, and as well as the doctors also, they will give a very good respect to the pharmacist. And the doctors, they will get the opinions, and they will ask the pharmacist to recommend some medications to the patients. Okay. So in almost all these countries, the practice for the pharmacist is highly advanced. And especially when it comes to clinical pharmacist, in case if you become a clinical pharmacist in hospital, then like it is a highly demanding job, and at the same time, it's a highly rewarding as well. And you will get a very good satisfaction that you will be like for whatever the things that we have studied. Okay? So especially in Form D, in case if there are any Form D graduates, so whatever the things that you have studied, so everything will be applicable in Australian hospital setups, in US hospitals, in Canada, in UK. So in all these countries, so the things that we have studied, so it will be practically, they all will be applicable. And the pharmacist will be given a high priority in the hospitals. Okay. So now I just want to discuss how important a pharmacist is and how a pharmacist can save the patient's life in Australian hospital setups. Okay. So like when once I just want to share, these are my live experiences that I have faced when I was working as a clinical pharmacist in the hospital. So in Australian hospitals, how it works is like every day the pharmacists need to go to the ward, and the pharmacists need to review the patient's medications. And whenever the patient get admitted in the hospital, the first person who will be talking to the patients will be the pharmacist. So the pharmacist will be one of the first persons who will go and interact with the patient. So the reason why the pharmacist should interact with the patient is the pharmacist is the person who will do the medication reconciliation. So all the patient's medication reconciliation, it will be done by the pharmacist. So initially, once the patient, they get admitted in the hospital, so we'll go and see the patient, and we will ask the patient that, can we get the complete list of your medications? And in case if the patient, they don't have the list with them, because by the time when they are getting admitted in the hospital, no one will carry the list. And also no one will bring the medications to the hospital. So in that case, it becomes the pharmacist's responsibility to contact their local pharmacy and get the complete list of the medication that what the patients they are taking at the moment. Okay? So we need to get all those lists, and the pharmacist should reconcile that list against the medication that what the doctors they have charted to the patient as inpatient. So in case if the pharmacist reconciliation is not done, then there will be a lot of errors that might arise, and which may lead to cause serious consequences. Even sometimes it may lead to cause the patient's mortality as well. So that's why the pharmacist reconciliation is the most important one. And here is one simple example that I would like to share, how important a pharmacist's role is in pharmacist medication reconciliation, initial reconciliation. So I was like 2 years ago when I was working in a hospital, a female, she was around 62 years, with a weight of around 120 plus. She got admitted in the hospital due to some ankle sprain problem, and she was completely immobile. And after she got admitted in the hospital, her heart rate was going high and high. So her heart rate was increasing. It went up to 160 beats per minute, and she was getting the palpitations and so on, sweating, palpitations, and so on. And that hospital where I was working, it was a isolated unit, okay? Because here in the Australian hospital setups, we also have certain hospitals which like they are separate isolated unit. They are known as isolated units, where only one junior doctor will be present, and that one or two junior doctors whom we tell it as the HMOs. So that HMO will be present, and those HMOs will be looking after the patients who are there in that unit. And only one HMO was there on the day, and her heart rate was increasing. So they called the Met call. Met call in Australia means it is an emergency call. So the other doctors also, they arrived, and they were thinking like, what happened all of a sudden? What happened to this patient? Okay. So they were worried about like what they need to do, what treatment that they need to start. They were contacting to other senior registers and so on. Then I was there. I have gone through all the patients' medications, okay, and I did the reconciliation immediately. I called the patient's family members, and I asked them what medication that she was on before she came to the hospital. And I came to know that she was taking a very high dose of the levothyroxine. So she was taking the normal dose of the levothyroxine. It will be around 100 or up to 150 micrograms per day, but her dose is 300 micrograms per day. So she's on a very high dose of the levothyroxine. And the doctors were not aware that she was on such a high dose of the levothyroxine. And immediately I informed that HMO, and we made a call to the consultation call to the cardiologist. And we also contacted the cardiologist, and the cardiologist, under the cardiologist guided to start giving the intravenous beta blockers. Okay. So in this way, finally, because of this levothyroxine, high dose of the levothyroxine, she started developing this tachycardias, palpitations, and tremors, and so on. Okay. So here, if a pharmacist hasn't interfered, and a pharmacist wouldn't have done the medication reconciliation, and if a pharmacist won't let the doctors know that what's going on with the patient's medication, then it becomes very difficult for the doctors to know that what's going on and why the patient is developing those symptoms. So that's why without a pharmacist in the hospital setup, it becomes very difficult for the doctors to treat the patient. So not only during the initial reconciliation, but also during regular medication review. So in the hospitals, for a clinical pharmacist, whenever the patients, they get admitted, at first the pharmacist will go and see the patient, and the pharmacist will do the medication reconciliation. And after doing the medication reconciliation, then the doctors will put the patient on inpatient medications. So they will chart on inpatient medications. And when they chart the inpatient medication every day, like each and every day, the pharmacists, they need to keep on doing the review for all those inpatient medications as well. So here is an example that I would like to share with you. Again, when I was working as a pharmacist. So like one of the patients was on amiodarone for cardiac arrhythmia. And that patient was really at a high dose of the amiodarone. And we all know that for amiodarone, the main problem with the amiodarone is it prolongs the QT interval of the heart. And it prolongs the QT interval, especially when it is combined with some other agents. They also have the same QT interval prolonging property. So the patient was on amiodarone. That patient got admitted in the hospital. And to that patient, the doctors, they have started on moxifloxacin for the respiratory tract infection. And moxifloxacin is another agent which have this QT interval prolonging property. So when amiodarone is combined with the moxifloxacin, then the QT interval prolongation will be more severe. And what happened was for that patient, when the doctors, they have started the moxifloxacin, On day 2, when I went to review the patient was complaining about the patient was complaining about some low blood pressure issues, and also he was complaining about like some dizziness and so on. So I asked the doctors to have a review, and ECG was done to the patient. And after performing the ECG, the QT interval was highly prolonged, okay? Which means that the patient has developed the bradycardia problem. Okay, so the heart rate has been reduced. Then immediately I mentioned to the doctor that moxifloxacin is not suitable for this patient. Okay? So because of this moxifloxacin, the patient has developed this QT prolongation issues. Then immediately they have contacted the infectious disease specialist, and they changed the moxifloxacin to another antibiotic. So in this way, the pharmacist plays a major role in everyday medication review as well. So not only during the everyday medication review, but pharmacist will also play a major role once the patient gets discharged from the hospital. So even during the patient gets discharged, again, the pharmacist will do the medication reconciliation. So without pharmacist medication reconciliation, if the patient they get discharged, there will be a lot of errors that may arise, and sometimes the patients again they need to get readmitted in the hospital. So here is another example that I would like to share with you guys. So there was a patient who got admitted in the hospital with a heart failure problem, with heart failure as well as the ventricular fibrillations, AF, atrial fibrillations. Then for that patient, the doctors, they have started him on digoxin loading dose. The loading dose is nothing but it is 250 micrograms of the digoxin. That is a very high dose of digoxin will be given to that given to the patients as a loading dose. Then whenever they start the patient on the loading dose, they should put the patient on the loading dose only for 24 hours. After 24 hours, they must bring back the patient to the normal dose. Okay? That is the maintenance dose. So unfortunately, what happened was the doctors, they have started the patient on the loading dose. And after starting the patient on the loading dose, on discharge, they put the same, they gave the same script of 250 micrograms digoxin to the patient on discharge. So when I was reviewing the patient discharge medication list, and also when I was doing the discharge reconciliation, I found that this 250 micrograms of the digoxin tablets, the doctor, they gave the script for the 250 micrograms digoxin. Then immediately I contacted the cardiology specialist, and then the cardiology specialist said that we should never go with the high dose of maintenance for the maintenance digoxin. Then immediately they have reduced the dose of the digoxin. Otherwise, the patient would get readmitted because of this digoxin associated toxicity in the hospital. So in this way, during each and every step, there will be a chances of errors that will occur in the hospitals, and there will be a high chances of errors that will arise. Always there will be high chances of errors that will occur in the hospitals. So starting from the medication reconciliation, and also during medication daily or the regular review of the medications, and also during discharge. So the pharmacists, they play a major role to save the patient's life. So here I can say that not only in hospital setups, not only the pharmacists play a major role in the hospital setups, but also in the community setup, that is in retail pharmacies. In Australia, Canada, US, UK, in all these countries, the pharmacists, they play a very major role, because pharmacist is the first healthcare professional who is easily reachable to the patient. So whenever the patient, they get any problems in these countries, I'm talking about Australia. So whenever the patients have any minor problems, that is the primary healthcare issues, they can't go and see the doctor, because getting the GP's appointment is a challenging task for them. So they can't get the doctor's appointment easily. But when it comes to the pharmacists, they can, anytime they can walk into the pharmacy and they can talk to the pharmacist. And if it is any primary healthcare problem, then the community pharmacist will always be ready to help the patients. So the community pharmacist will help the patient in resolving those primary healthcare issues. So, and also in community pharmacies, they also have another major roles, like community pharmacists, they are experts in primary healthcare, and also community pharmacists, they provide the vaccinations to the patients. So to all the community, they will provide the vaccinations. And also few pharmacists in Australia, so they are the community pharmacists, but at the same time, they are consultant pharmacists. So consultant pharmacist is nothing but a consultant is a person who is considered as like a specialized pharmacist. Okay, so in order to become a consultant, there will be like 1 year course, or it depends on how fast we finish that consultant program. So we need to enroll in that consultant program, and we need to finish that program and become a consultant pharmacist. I'm a consultant pharmacist here in Australia. So what we do as a consultant is we will help the doctors to review the patient's medication, home medications of the patients. So we will go to the patient's home and we will review all the patient's home medications, and we will identify if there are any issues that are present, if there are any issues that are associated with the patient's medication. Then we will write a letter to the doctor saying that the patient is on so and so medication. The patient is on hydrochlorothiazide, which is not at all essential for the patient at this moment, based on the patient's all the other comorbid conditions. So the patient is on hydrochlorothiazide, which is not an essential to the patient at this moment. So the doctor will take it into consideration, and if necessary, that the doctor will de-prescribe those medications. So in this way, a pharmacist, a consultant pharmacist, he will go and see the patient in person, and the consultant pharmacist will be working in close relation with the doctors. Okay. Now, the main question it arises: does the pharmacist job gets rewarded well in Australia, New Zealand, UK, US, Canada? Of course, it is well rewarded. For example, I'm talking about the Australia. So in Australia, while doing the internship, that is supervised training, you will be paid $27 per hour during internship. But when once after completing the internship and you become a fully licensed pharmacist, that is, it takes around 1 year to get that license. So when once you get the license, then your starting salary will be $40 per hour. $40 per hour. In community setup, in community pharmacists, so this salary, after 2 years or 3 years of experience, it may go even up to $50 or $55, depending on your performance and how you negotiate with the employer. And when it comes to the hospitals, in the hospitals as well, it will start with $35, $38 or $40 per hour at the starting pay rate. But in hospitals, in 5 years or in 8 to 10 years of time, so that pay, it will go up to $60 or $70, or even in my hospital where I'm working, the seniors, they are getting up to $80 per hour, who are known as the grade 3 pharmacists. So they will be paid up to $80 per hour. So it's a highly rewarding job in Australia. The same thing in New Zealand, Canada, US, UK as well. So in all those countries, the pay rate will be very high for pharmacists, and especially when it comes to a consultant pharmacist. So for consultant pharmacist, they will be having a separate pay rate because they are the consultants, and they will be working in close relation with the doctors, and they will be providing the recommendations to the doctors. So for consultant in Australia, so after, if they do one consultation with the patient, so which means that if they go to the patient's home, and if they review the patient's medications, and if they make some recommendations to the doctor regarding the patient's medication changes and so on, then for each consultation they will get around $300. So which takes like 1 hour time for the pharmacist to do the home medication review. So which means that per hour the pharmacist is earning $300. So this $300 is extra from what they get the normal salary. Okay, so the normal pay rate, apart from the normal pay rate, so they will, at the evening times or on weekends, they will go and do these consultations. And in Australian practice, a pharmacist is allowed to do up to 30 consultations per month. So 30 times $300. So this thing is an extra amount that what they get apart from the regular salary. Okay, so I can say that it is a highly rewarding job in Australia and also in all the other countries. The same thing goes in Canada as well. Okay, so in Canada as well. So right now in Canada, the pharmacist job, like the pharmacist position, is highly required at the moment, because Canada exam, clearing the Canada PBC exam is one of the toughest exams. It is one of the toughest exams, and it's a big challenging for the candidates to clear this PBC exam. So only 25% of the candidates are successfully clearing their PBC exam. So that's why whoever they clear the exam, for them the job guarantee will be there in Canada. Okay. And also in Canada as well, there will be a consultant pharmacist. Even in Canada, the consultant pharmacist will be there. So consultant means they will be having the prescribing rights as well in Canada. So they can prescribe few medications. Okay. And the practice in Canada is also highly advanced when compared to other countries. Okay. Then now, okay, so this is one of the pathways, like as I'm discussing about the global opportunities for the pharmacists, and especially those who have graduated in India. So becoming a pharmacist in Australia, US, UK, Canada, and working as a pharmacist, like a clinical pharmacist. So this is one of the pathways. And what about, are there any other chances, like apart from this pharmacist, are there any other scope for to migrate to Australia, to US, UK, Canada, and practice there? So I would like to discuss about the scope of clinical research in Australia, because I have gone through these things. Okay, so in clinical research in Australia, because I have many friends who are currently working in the clinical research, okay, as the clinical research coordinators and so on. So the thing what I came to know from them is, if like in this field, in this sector, anyone can enter easily. Okay, so they need not to be only a pharmacist. So any biomedical graduates, they can enter into this field, into this clinical research site. So the pharmacist, whoever they enter, will be considered same as that of the other professions. Okay? But in case if a pharmacist is not a registered pharmacist in Australia, okay, if they are not a registered pharmacist, so if someone comes to Australia on for example, if someone comes to Australia to pursue their PhD, and after PhD, if they want to enter into the clinical research site, so they can enter into the clinical research, but the pay rate for them will be very less. Okay, so the pay rate for them will be very less. So the one, if a candidate is already a registered pharmacist, okay, and if they work as a clinical research site, then for them the pay rate will be higher, because in clinical research they will have a position known as clinical research pharmacist. Okay, that position is known as clinical research pharmacist. It means that they need a licensed pharmacist to work in that particular position. Okay. So if we want to get a very good reward in clinical research site, okay, then again, I always recommend to become a pharmacist first. Okay. If you become a pharmacist, then later you can try for the clinical research jobs in Australia, then your pay rate will be very high. So without a pharmacist, if you start working in the clinical research, then you will get $80,000 package per annum. Okay? $80,000 package per annum. That's the starting pay. That's the starting pay rate. But if you are a pharmacist and if you enter into this clinical research as a clinical research pharmacist, then your starting pay rate will be at around $120,000. Okay, $120,000 in the clinical research side. Okay, so there is a huge difference in the salary. Okay, when it comes to a non-registered pharmacist and a registered pharmacist who enter into this clinical research side. Okay, so that's about the clinical research. And then here are the basic questions that most of the candidates, those who are graduated in India, they might be thinking about pursuing the masters in overseas. So in case if you are planning to pursue a master's in overseas, okay, so there are many pathways. There are many different fields are available where you can go and do your master's. So like master's in public health, okay, or master's if you are specifically interested to do master's in pharmaceutical sciences, okay, then master's in clinical pharmacy. Master's in clinical pharmacy would be a highly rewarding position, because once you do a master's in clinical pharmacy and you finish the master's in clinical pharmacy, then you will be landed straight away in the hospitals, in the Australian hospitals. So here the thing is that in Australia, there are only few limited hospitals are there. Okay? So the same thing in Canada as well. So getting a clinical pharmacist job in the hospitals is highly, it's really a highly difficult task. Okay? So to become a clinical pharmacist in hospitals, like we need to struggle a lot. Even for me, it took more than 1 year time to enter into the Australian hospital setup. And the same thing goes in Canada, UK as well. In all these countries, entering into the hospitals is a bit challenging task. But those who have the master's in clinical pharmacy, okay, so especially those who do the master's here in Australia in clinical pharmacy, then they will get a high chance to enter into the hospitals because they have a higher degree, and that too, it is in clinical pharmacy, master's in clinical pharmacy. So they will be getting a higher chance to enter in the hospitals and become a clinical pharmacist. But there are also other drawbacks here. So we need to also consider about what are the disadvantages or the drawbacks, okay, by selecting this master's in clinical pharmacy. So this master's in clinical pharmacy program, it will be for 2 years program in Australia. And in order to finish this program in Indian currency, we need to spend at least 40 to 50 lakh Indian rupees. Okay? So we need to spend around 40 to 50 lakh Indian rupees to finish this master's program. And while doing this master's program, so you will be allowed to work only 24 hours per week. Okay, so only 24 hours, that is 3 days per week. So you can do your part-time job. But I also recommend that in case if you are planning to become a pharmacist in Australia, so you can clear the exam first, that is the OPRA exam. And at the same time, if you are interested to do the master's in clinical pharmacy, so you can take the admission in any one of the universities and you can move to Australia and start pursuing your master's in clinical pharmacy. And you can start doing your internship as a part-time. So part-time in the sense that is 3 days per week. So you can start doing the internship. Okay. And with that, you can complete your internship. And also, after finishing the internship, then you will become a fully licensed pharmacist. And at the same time, you will also have this master's in clinical pharmacy degree with you. Okay? So which means that you will be at a higher position, and definitely the hospitals will be open for you, and you can enter into the hospitals as a grade 1 pharmacist. So this is about the career opportunities for masters in overseas. But again, there is another problem. If you migrate to do the masters, not in clinical pharmacy, but any other program like masters in public health or any other things, okay, then the main challenge is after doing the masters, either in US, UK, Canada, Australia, New Zealand, wherever it is. So after doing the masters, you won't get the permanent residency, that is the PR. So in order to get the permanent residency, you need to work in the same field. Okay? But after doing the masters, so you won't get the employment in that field. Okay? So that's another big challenge. So these things that we need to keep in consideration before we take any decision to pursue the masters in these countries. So let's say, for example, if a candidate has spent around 40 lakh rupees and moved to and migrated to Canada and has finished his masters in Canada, and after finishing the masters, there is no guarantee that he will get the PR in Canada. And at the same time, he won't be allowed to work as a pharmacist in Canada because he hasn't cleared his licensing examinations. So which means that it will be a high stressful position for the candidates at that stage. Okay. So rather than doing those things, I always recommend any candidates, those who are, especially those who are planning to migrate to overseas, okay, plan well. Okay. Take some time. It doesn't matter. Even if you lose 1 year, it doesn't matter. So take some time, plan well, prepare well, and migrate to overseas. Okay. So this is the main key message that I would like to give it to you guys. Okay. And the same thing even for the PhD. So if you are planning to pursue PhD in Australia or US, UK, Canada, so you can just apply for the PhD courses. And again, it depends on your number of publications, your research experience, as well as there are a lot of factors that the universities will go through it. And once they, if you are one of the candidates, then they will give you an offer letter for the PhD, and you can they will give the full scholarship for the PhD as well, and then you can start doing the PhD. But again, after PhD, the question mark it arises. Okay, so even after PhD, there is no guarantee that you can secure a job in these countries, because if you are a licensed pharmacist and if you have done the PhD, then the scenario will be completely different. Okay? So you will land in very big pharmaceutical companies at a higher positions. But because if you are a licensed pharmacist, then you will get the PR. Okay? So getting the PR, the pharmacist pathway is the easiest way through which we can get the PR. But through PhD pathway, it is highly difficult to get the permanent residency. So these are the things that we need to keep in consideration before we take any step. Okay? So I would like to thank once again to our chief guest, Dr. Deependra Singh, and to all the IPGA Women Forum members, to Dr. Manju Singh, and to Dr. Vandana, and Dr. Ramanpreet and Dr. Geeta, so for organizing this event. And now we are open for to take your queries. Okay? So if you have any questions regarding either to prepare for the licensing examinations or how to migrate to any of these countries, so you can just ask to us and we will be happy to answer your queries.
After PG of Pharmacy, I will go to the foreign country. Please send me your process.
Sorry, after completing the pharmacy?
Sorry, sir?
Sorry, what's the question, please?
आप हिंदी में भी पूछ सकते हो.
Sir, after M Pharma, just I want to go foreign country, then I don't know process.
So after completing the Masters of Pharmacy, so you would like to know that which country would be the better to go and work as a pharmacist? Is it your question?
What, sir?
Sorry, after completing the Masters of Pharmacy, that is the M Pharma. Okay, so
Yes,
which country would be the better to go and work as a pharmacist? So is it your question?
Like Australia.
Yeah.
Sir, just like country of Australia.
Just like country of Australia. So you're asking about what about the other countries, or एक काम करो आप हिंदी में पूछो.
सर मैं एम फार्मा के बाद मैं फॉरेन कंट्री जाने के लिए प्रिपरेशन करना चाहता हूँ, तो मुझे क्या करना होगा?
ओके, अगर आप फॉरेन कंट्री आना चाह रहे हो आफ्टर एम फार्मेसी, तो आपको जो है सो 2 पाथवेज है. एक जो है आप मास्टर सेलेक्ट कर सकते हैं, मास्टर ऑफ फार्मेसी, मास्टर ऑफ फार्मेसी प्रोग्राम. तो लेकिन इसमें जो है, अगर आप मास्टर्स करने के लिए इधर आ रहे, तो यहाँ पे आपको एक ड्रॉबैक है कि you need to spend initially. You need to spend some amount. Okay, so you need to spend some money to pursue your masters in Australia or in New Zealand or Canada or US. Okay, आप जो भी country आप select करते हैं तो वहाँ पे जो है सो आप you need to pay the tuition fees. Okay. और आपका 2 years masters होगा.
नहीं सर, आई एम परस्यूइंग द मास्टर इन एसडी कॉलेज मुजफ्फरनगर.
ओके.
इन फार्माकोग्नोसी.
इन फार्माकोग्नोसी. ओके, तो ठीक है. अगर आप मास्टर्स अब ऑलरेडी आप मास्टर्स कर रहे हैं तो इफ यू आर नॉट इंटरेस्टेड टू मूव एंड परस्यू द मास्टर्स फर्दर, ओके, इन ओवरसीज, then what you can do is you can go through this licensing exam pathways. Okay, so अगर आप licensing exam pathway के थ्रू अगर आप कौन से भी एक country का licensing exam अगर clear कर दिए, okay, either Australia or Canada or New Zealand or UK, okay, तो अगर इस countries का अगर licensing exam अगर आप clear करें तो आप जो है directly as a pharmacist आप work करने के लिए एक country चले जा सकते हो. Okay, so you can migrate straight away as a pharmacist. Straight away you will migrate there and you will start working as a pharmacist in these countries.
Okay. इस एग्जाम वगैरह कैसे अवेलेबल होते हैं?
ऑस्ट्रेलिया का एग्जाम जो है साल में 3 बार होगा, 3 मर्तबा होगा. एक जो है मार्च में रहेगा, दूसरा जो है जुलाई में, फिर तीसरा जो है नवंबर में. So there will be 3 times. Australia will conduct this exam 3 times in a year.
सर कहाँ से इसके फॉर्म वगैरह अवेलेबल होंगे, मतलब कहाँ से हम लें उसे या किस साइट से?
जी, आपको जो है इलाइट एक्सपर्टीज आपको कंप्लीटली इसमें हेल्प करेगा. अगर आपको एग्जाम कैसा असेसमेंट कराना, आपका डिग्री सर्टिफिकेट कैसा उसको वेरिफिकेशन कराना, तो ये सारे स्टेप्स में जो है तो हम लोग आपको हेल्प करेंगे. इलाइट एक्सपर्टीज विल हेल्प यू. एंड at the same time, like if you want to do it by yourself, so you can go and visit to Australian Pharmacy Council. Australian Pharmacy Council बोल के आप Google करो. So when you Google it, then you will get the Australian Pharmacy Council website. And in Australian Pharmacy Council website, so they will provide all the information there. So from there, you can start. You can at first you need to create your student profile, the ID, and then you need to start uploading all the documents.
Okay. Thank you, sir, very much.
Ji, thank you.
Sir, good morning, sir.
Hi, good morning.
Sir, is any age limit is there to work in New Zealand and Australia?
Age limit in the sense, like I can say that there is no age limit.
Hello,
to...
sir. Hello.
Yeah. Am I audible now?
Yes, sir, you are audible.
Hello.
So, there is no age limit. There is no age limit to work as a pharmacist in these countries. Okay, to Australia, New Zealand, Canada, or any countries. Okay, and there is no age limit to write the exam as well, because right now, in the last batch, like 2-3 years back, in Elite Expertise, so there was a candidate. So there was a sorry guys, can you please mute yourself? Yeah. So there was a candidate who was 68 years age. Okay? So he appeared for the exam. He did the exam. Okay? And even right now, we have many candidates who are around 50 years age and more than 50s as well. So they are appearing for this exam. So here the problem it arises with the immigration. Okay, so in order to appear for the exam, there is no age limit. Okay, but if you want to migrate on permanent residency, if you want to get the permanent residency in Australia or in New Zealand or any countries, so if you want to get a permanent residency, then you won't get the PR, because and if the age is above 45, then all the candidates who above 45, they are not eligible to get the permanent residency. But you can still keep on working on a sponsorship visa. So you need to, those who have crossed above 45 years, what they need to do is, so they need to find the employer, and the employer will sponsor them. And if you get the sponsorship from the employer, then you can work as many years as possible. Okay, as long as the employer will keep on renewing your visa, then you can work here in Australia.
Hello, good morning, sir.
Hi, good morning.
Sir, I want to ask you that how much money do I have to spend like to do MPharm in other countries?
Yeah, to do the MPharm, roughly it will go up to 40 lakh Indian rupees, 40 to 50 lakh Indian rupees. It will be either if you do in Australia or Canada or any of these countries. So roughly it goes up to 40 to 50 lakh Indian rupees. But so this amount is mainly for if you are planning to do MPharm in pharmacy, that is pharmaceutical sciences, then it will go up to 40 lakh Indian rupees. But if you want to do masters in any other field, okay, so not in pharmacy, but if you want to do the masters in any other field, then it may go up to 30 lakh rupees. Okay? But specifically, if you want to pursue your masters in pharmacy, then it will be plus 10 lakh extra you need to calculate.
Okay, thank you, sir.
Yep, thank you.
Sir,
A very good morning, sir. My name is Shivam Thakur, and I have completed my bachelor's of pharmacy, and currently I am pursuing PharmD. So my goal is to be a nuclear pharmacist or a radio pharmacist. And my question is, what path should I take or course should I take to be a nuclear pharmacist?
Yeah, very good question, Shivam. So here, because for nuclear pharmacy, it is something which is new, which is not which hasn't been for many decades. It is something which has been new, that has been introduced. So in US, they are already they have started this nuclear pharmacy, and slowly now they are implementing in other countries as well, like in Canada, Australia. But in order to become a specialized in nuclear pharmacy, okay, so for any specialty, doesn't matter if you are interested in nuclear or if you are interested in cardiology or oncology or neurology, nephrology, anything, it doesn't matter. So what we need to do is, at first we need to get that country's license. Okay, so at first you need to get the US license, because as you are PharmD, as you mentioned that you are doing the PharmD, so target for the NAPLEX and clear the NAPLEX. And after getting the NAPLEX license, now you need to go into that specialized field. Specialized field, in order to become the specialized field and to become a specialized pharmacist, there are two options that which are available. So especially I'm talking about the US. Okay, so in US, the two options that are available is, one is straight away you need to enter into the hospitals in US hospital as a level 1 pharmacist. Okay, as a level 1 grade 1 pharmacist, and you need to keep on working as a grade 1 pharmacist. And every year there will be promotions. They will create the positions or the promotions for the pharmacist, and in that they will put the applications for the interest. So where the pharmacists are allowed, all the hospital pharmacists who are working in that hospital, so they will be given a chance to put the interest in which field that you want to work. Okay, then we need to keep on giving our interest in that field. Okay, then if that rotation, if you won't get the chance, then in the next rotation they will put you in that field. Okay, so in this way, the same thing in Australian hospitals as well. So actually my interest was to become a cardiology pharmacist. So initially I entered in the hospital as a grade 2 pharmacist, and then after that in the rotations I applied for the interest in the cardiology. Then they gave me the chance in the cardiology, and for 1 year I worked as a cardiology pharmacist. Then after that, the next rotation they put me in the neurology. Then I worked as a neurology pharmacist, and also in the meanwhile I also worked in the oncology and so on. So in this way, in the hospitals, so at first we need to enter into the hospital, then we need to slowly we need to keep on targeting our main sector, okay, in which we want to become a specialized pharmacist. But in US, this is one of the pathway, and the other pathway in US is you can also clear your BPS exams, that is the Board of Pharmacy Specialization exams. Okay, so for nuclear pharmacy, there is a special exam is there. So you can prepare for that exam, target that exam, clear that exam. So when you have cleared that exam, then you can strongly show your resume to the director of the pharmacy in that hospital, and you can ask for that position. Then, as you have already cleared this exam, okay, then they will consider you in that field, okay, and they will promote you into that nuclear pharmacy field. Okay.
Thank you. Thank you for the clarification, sir.
Okay, Shivam. Thank you.
Sir, there is one more question in chat box. Is there any chance to get a job in pharmacy colleges?
In pharmacy colleges?
Yes.
Like in pharmacy colleges, there are chances, but they need to have the PhD. Okay. So if they have the PhD, and if they have the PhD, and if they have permanent residency, that is the important one. Okay. So if they have PhD and permanent residency in Australia, then many universities, they are opened. So many universities, they are opened for the initial lecturer position, and they will hire as a lecturer or as a junior or the assistant professor position.
Sir, could you tell us how to get the study material? Can you recommend any website to download the study material for OPRA?
OPRA, yeah, for OPRA, once you can visit to the Australian Pharmacy Council website, okay? And in the Australian Pharmacy Council website itself, they have clearly mentioned that what are the subjects that are involved and what are the reference books that you need to follow. Okay? So they have clearly mentioned about what references books that you need to study. Okay, so it will be there in the Australian Pharmacy Council website.
Thank you, sir. Thank you.
Hello, sir.
Thank you. Yes.
Sir, regarding that pharmacy colleges options, before that also we have to pass this OPRA and all, or any other exam we have?
Pharmacy college options, in the sense, like in order to become a lecturer in any one of the colleges or in any one of the universities, either in Australia, New Zealand, Canada, or US. So the first question, when even now, you can try to Google and search the university jobs in US or university jobs in Canada, university jobs in Australia. So you will get a list of the jobs which are which you will can see those jobs. Okay, but when you click that job position, and when you go and read the criteria for the job, and they will clearly mention that, okay, you should be having the PhD, and you should be having so and so, you should be having so and so, and at the same time they will also mention that you should have a valid work visa. So you should have a valid work visa in order to apply for this position. Okay, so valid work visa, in the sense, who will have the valid work visa? Only those who have the permanent residency, they will have a valid work visa. Okay, so without having this permanent residency, it's difficult to, no one can have this work visa. So in order to get this permanent residency, the pathway to become a permanent residency is either in Canada or Australia, New Zealand, and all these countries, is to clear the licensing exam. So if you clear the licensing exam, and if you become a pharmacist, and at the same time, if you get your permanent residency, then you can target the university jobs as the lecturers. Okay, because one of the criteria in all the university jobs as a lecturer in the universities here in Australia or Canada, US, in all these countries is, so they will also put one more condition that you must have the license to practice in Australia. So you must have the license to practice in Canada. You must have the license to practice in US. So these are the other conditions that they will implement for university job positions. And all the university lecturers and the professors, those who are working here, so they will be working along with me in the hospital as well. So one day they will be working with me in the hospital. So here in these countries, there is a important that I will tell you, even if they are non-practicing persons, non-practicing in the sense for university lecturers or for university professors, okay, so those who won't be practicing, so all those non-practicing persons, in order to maintain their license, if they want to maintain their license, because in Australia every year we need to get our license renewed. Okay, so every year we need to keep on getting our license renewed, and during renewal they will ask the question that, are you practicing? How many hours are you practicing per year? How many hours are you practicing? So these are the questions that they will ask when we go for the license renewal. So that's why the professors who are working in the university, still they will come and work in the hospitals at least one day per week. Okay, they will work in the community pharmacies at least one day per week in order to maintain their license. So this is the important thing in these countries. Maintaining license is the most important one. So even though they are a very high grade professors, okay, so they will be getting around $200K salary, that is $2 lakh package, but still for one day they will come and work in the pharmacies because they want to maintain their license. Okay? And maintaining the license is the important in these countries. So
okay, sir.
my final.
Thank you, sir. How long you have to work as this community pharmacist or other pharmacist to get this permanent residency in such case?
Like for permanent residency, actually after clearing this OPRA exam, they can apply straight away. And there are two pathways, two visa pathways, that is the 491 and 190 visa. So these are straight away permanent residency. And if they can get this visa, then straight away they can move as a PR. Otherwise, what they can do is they can get the sponsorship from any employer, and they can start working as a pharmacist under the employer for at least a few years, like 2 or 3 years, and they can apply for the permanent residency while they are working here. So in that way, they will get the PR.
Okay, sir. Thank you very much.
Sir, what is the average package of pharmacist for initially for fresher after B.Pharm or M.Pharm, if someone is qualified licensing exam?
Yeah, so the package for the pharmacist will be, it will start from 80,000 per annum, 80,000 Australian dollars. The same in New Zealand and in Canada as well, 80, 85, 90,000, okay? Depending on in which place that we are working. Okay? There are some, if you are ready to go and work in the regional places, regional in the sense, the remote areas. Okay, if you are ready to go and work in the remote areas, then there you will get the highest pay. So they will pay even up to 90,000 starting salary. But if you want to stay in cities where there is a huge competition, there will be a lot of pharmacists are readily available, then you will get around 80 or 85,000 Australian dollars per annum.
And what is the average expenditure of a single person or to stay there?
Yeah. Expenditure, it completely depends upon us. So the type of car that we buy, the type of house that we want to stay. But I'm letting you know, in case if we spend a minimal life, okay, then within $20,000 will be more than enough per annum to spend like a middle class life in Australia. $20,000 per annum will be enough. Especially when we are at the bachelor level, so that amount will be enough, and the remaining 60 that we can manage to save.
Okay, sir. Thank you.
Yeah. Any further questions, guys?
सर चैट बॉक्स में कुछ क्वेश्चंस हैं। एक स्टूडेंट पूछ रहा है कि ऑस्ट्रेलिया में लोग हॉस्पिटल क्लिनिकल फार्मेसी को चूज करते हैं और इंडिया में इंडस्ट्रीज को चूज करते हैं, तो इतना डिफरेंस क्यों है दोनों कंट्रीज के बीच में?
जी, अभी अगर देखो कि ऑस्ट्रेलिया, कनाडा, यूएस, यूके, इन सारे कंट्रीज में जो है हाईएस्ट पोजीशन और इन और आई कैन से दैट हाईएस्ट पेड प्रोफेशन विल बी द क्लिनिकल फार्मासिस्ट, क्योंकि इधर जो है हेल्थ केयर प्रोफेशन हाईली एडवांस्ड है, और फार्मासिस्ट का रिक्वायरमेंट in these countries is very high. So that's why they are paying high in this field, and the demand is also high for the clinical pharmacist in these fields, in these countries. And the other thing that I can tell you that in India, like we have got many pharmaceutical companies. In almost all the major cities, they have got the pharmaceutical companies. And India is the main market which exports the medications to other countries. Like even in Australia, 50%, more than 50% of the medication that we get from Indian market. So which means that India is focusing mainly on the production and on the pharmaceutical companies. But in Australia and Canada, we don't see such huge pharmaceutical companies. Only few companies are here in Australia. So that we can count on our fingertips. So only few companies are there. So that's why there is no much scope for industrial pharmacists here in these countries. But clinical pharmacists, they have a very high demand.
Sir, there is one more question in chat box.
Yes, ma'am.
So for masters in pharmacy, is there any exam to get admission on the basis of scholarship?
Like there is no exams, they won't conduct any exam, ma'am, but it depends on their IELTS score. If they get a very good IELTS score, or the universities, they are also accepting the other alternate exams like OET, Occupational English Test, and the Pearson Test of English. So depending on their English language score, and also they will go through the bachelor degrees, how many credentials and so on. So depending on that, the universities, they will decide that how much scholarship that they can offer to the candidate. So it depends on universities to universities. And always I recommend the candidates, if you are planning to do the master's, select the university which is offering a higher scholarship rather than the university which is not at all offering any scholarship and where the fee is much higher.
Thank you, sir.
Yeah, thanks, ma'am. Any further questions?
Hello, sir.
Yeah, hi.
Hi. So, what's the pathway after B Pharmacy and PharmD in USA, and what licensing exams a candidate has to clear?
Okay, so after completing the PharmD, okay, so in US, in order to become a pharmacist, at first you need to clear the basic, that is the overseas screening examination for all the overseas pharmacists, SPLAX. Okay, so that's the exam that you need to appear for, that exam, SPLAX. And after clearing that exam, okay, then you will enter into the main exam, that is the NAPLEX. Okay? So first clearing this overseas screening exam, and after clearing this overseas screening exam, then you will appear for the NAPLEX exam. So after clearing this NAPLEX exam, there will be another exam which is known as the jurisprudence. Because there are many states in US, each state will have their own law and ethics exam. So in wherever the state that you want to get registered, so you need to appear for that state's law and ethics exam. So once you clear that law and ethics examination of that state, then you will get the full license to practice in US.
And after B Pharmacy, what are the options and pathways? Okay, thank you.
After B Pharmacy for US, unfortunately, there are no options. So in order to become a pharmacist in US, so you must have the PharmD degree. So without PharmD degree, we can't practice in US. Okay. The same goes in Ireland as well. So they are required. So they just want the PharmD degree to practice there. So what happens here is, in case after completing the Bachelor of Pharmacy only on B.Pharm, if you want to practice, if you want to appear for the exams, for the NAPLEX exam, then the pharmacy board, they will ask you to do the Form D first. Okay, so they will ask you to do the Form D. So if you want to do the like already, if you have done the Form D in overseas, like in India, then they will accept that Form D degree. And I'm talking mainly about for those who are already in US now, those who are already in US, and for all the candidates, those who are already in US, and if they like those who have done their only Bachelor of Pharmacy, and if they are in US at the moment, and in case if they want to write this NAPLEX examination, for all those candidates, the pharmacy board is asking them to do the Form D in US first, like the post-baccalaureate, how we are doing here in India. In the similar way, they need to do the Form D there, and after doing the Form D, then they will get the eligibility to appear for the NAPLEX exam.
Sir, there is one more question in our live chat box.
Yes, ma'am.
One student is she's asking, sir, currently I am preparing CAPS exam and my exam is in November. Currently I also got CET from pharmacy practice, so I'm get confused to whether to take admission or not. Please guide me.
So she got the admission in from pharmacy practice?
Yes, sir.
Okay. So like if you have got the admission in MPharm pharmacy practice and already you are appearing for the CAPS examination in coming November. So here there are two things that I would like to let you know. So as you are appearing for the CAPS examination, and if you have cleared this CAPS examination, then based off once you clear the CAPS examination, then Australian Pharmacy Council will give you a skills assessment letter saying that now your Indian qualification, your Indian degree from whatever the university that you have got the degree. So now your Indian qualification is equivalent to Australian pharmacy degree. Okay. After clearing this exam, you will get this certificate that is known as the skills assessment letter. So based on the skills assessment letter, what you can do is you can lodge for you can lodge for the permanent residency visa. So there are two permanent residency visa pathways. One is 491 and the other one is 190. So you can apply for both the categories. Okay. So but these days straight away getting the PR is becoming a bit challenged, especially for the pharmacists. Okay. So you can also do another thing apart from these two visa categories. So there will be another visas which are known as the sponsorship visas. So you can also have a look through the sponsorship visas, contact the employers here in Australia. In case if you get the offer letter from any one of the employer, then you can apply for sponsorship visa. Okay, and you can migrate on that sponsorship visa. But the third option, in case if you are really interested to move to Australia and also to do the clinical pharmacist, because as I mentioned that if you do a clinical pharmacist in Australia, then the doors will be open for you in the hospitals, because in hospital interview, in case if they get, there will be only one position for which they will post that interview, and they will get at least around 100 applications from the candidates. So out of the 100 applications, they need to sort out only 3 candidates and ask the candidates to, and they invite the candidates for the interview. So when they are sorting out the candidates, they will have a look through which candidate's profile is stronger. So if they have already the masters in clinical, then they will select those candidates. And if you have the masters in clinical, then you will get the opportunity to attend the interview, to appear the interview. So these are the add-on advantages if you do the masters in clinical pharmacist in Australia. So if you want to try only on the PR pathway, as already you are getting, as you are appearing for the CAPS exam, and if you clear the CAPS exam, you will get the letter, and based on that letter, if you want to try for the PR pathway, so you can keep on trying for the PR pathway. Otherwise, go for the sponsorship, take the sponsorship and come to Australia. But in case if you find that, okay, this PR pathway or the sponsorship is taking some time, like 8 months or 1 year time. Okay. And if you want, already if you have the job offer, university offer letter to start your clinical pharmacy master's, so you can also move on that thing. Any further questions, guys?
सर YouTube में एक क्वेश्चन है.
Okay,
सर
Rakesh.
YouTube में एक क्वेश्चन है. If I will do M.Pharm for MS in Australia, should I write OPRA to get registration in Australia?
No. In case there is another thing that I would like to discuss with you. So if you do masters in pharmacy, masters in pharmaceutical sciences, that is M.Pharm, it should be the M.Pharm, that is 2 years degree, masters in pharmacy in Australia from any university, it doesn't matter, from any university. Let's say, for example, if you have done your bachelor and you move to Australia to pursue your master, so after you do the master's, which means that now you have got your master's degree with you in your hand. Okay. So when you get this master's degree in your hand, you need not to appear for this OPRA exam. Okay. So this OPRA exam will be exempted for all the candidates, those who do the master's in Australia. Okay. So the current CAPS examination or the upcoming OPRA exam, so all these exams are exempted for those who do the masters in pharmacy in Australia. So if you do the masters, then you need not to do the OPRA exam. Straight away, you will start your internship. And in the internship, there will be 2 exams. That is the written exam as well as the oral exam. Sorry. And you need to do those exams. Okay? So the written and the oral exam, that is common for even for the local Australian graduates as well. So whoever they study in the Australian universities, that is the local Australians, so they also need to write the intern pharmacist written and the intern pharmacist oral exam to get the final license in Australia.
Sir, a last question. What is the minimum requirement for English to get registered as a pharmacist in Australia?
So the requirement for English language is, if you are going through IELTS exam, International English Language Testing Exam, IELTS. So if you are going through IELTS, then you need to score 7 bands in each. Okay? So 7 in listening, 7 in reading, 7 in speaking, and 7 in writing. Okay? Then you are eligible to get registered with Australian Pharmacy Council. But there is another exam which is known as the Pearson Test of English, PTE. So in Pearson Test of English, if you can score up to 65 in each, 65 in listening, speaking, reading, and writing, then the 65 in PTE is equivalent to 7 bands in IELTS. 65 in PTE is equivalent to 7 bands in IELTS. And trust me, like all the candidates, all my students, so they are going through the PTE, and getting 65 in PTE is so easy when compared to 7 in IELTS. So I recommend you to go with Pearson Test of English. Everyone, like, it is so easy, 100% you will clear your English exam. Okay? So you need not to worry. But if you go through IELTS, then it will be difficult. For most of the candidates, it will be difficult to score. Either they will be losing either in the reading part or in the writing part or in listening part. But if it is the PTE, then easily you can score and you can gain that 65.
सर, कनाडा का जो PBC एग्जाम है उसमें कोई रिसेंट अपडेट हुआ है, और क्या PBC के लिए आप कोई स्पेशल इंस्ट्रक्शंस दे रहे हैं बच्चों को, जो बच्चों के लिए यूजफुल रहे?
जी राकेश, अभी PBC में भी अभी ऑपरा में, अभी ऑस्ट्रेलिया में जैसे कि मार्च से न्यू एग्जाम लॉन्च करे, ऑपरा एग्जाम। अभी एट प्रेजेंट जो है सो कैप्स एग्जाम चल रहा है ऑस्ट्रेलिया के लिए, और मार्च से जो है सो ऑपरा एग्जाम, न्यू एग्जाम जो है सो ऑस्ट्रेलियन फार्मेसी काउंसिल लॉन्च कर दे रहा। तो इसी तरह इवन PBC कनाडा में भी जो है सो कमिंग फ्रॉम जून दे आर गोइंग टू change the exam pattern. So the current exam pattern, the blueprint, it is applicable only till March 2025, but from June they are completely changing that exam pattern. Again, the same thing that I would like to tell you, even in Canada PBC, so they are focusing mainly on the pharmacy practice component. Okay? So pharmacy practice component. Right now in Canada PBC, they are asking a lot of questions from the biomedical sciences. But from June 2025, they are completely removing those biomedical component, and they are focusing mainly on pharmacy practice. And the candidates, they need to be aware about Canadian healthcare system and indigenous healthcare system in Canada. So these are the few things that they have included in PBC examination. And at Elite Expertise, like right now, we are providing the training for this OPRA exam, and current the CAPS batch is going on, and we are starting this OPRA training from 5th of November. So 5th of November will be the OPRA batch that is going to start. And even for the PBC, the current PBC batch is going on. And at the same time, for June 2025, so we are completely modifying, we are completely changing the our lecture content and everything. So based on the 2025 June exam new blueprint.
Thank you so much, sir.
सर कोई वर्कशॉप भी कंडक्ट कर रहे हैं सर आप पीईबीसी के रिगार्डिंग, जिसमें बच्चों को पीईबीसी एग्जाम के बारे में ज्यादा इंफॉर्मेशन मिले?
Yes, Rakesh. So we are going to conduct a workshop on PBC, which is on coming 9th of November. So on coming 9th and 10th. So on 2 days, there will be a workshop for the PBC candidates. So one is for the 9th of November, we are conducting this workshop mainly for the Indian students, for the Indian graduates. So whoever they are planning to appear for this PBC. And on 10th, we are targeting the Canadian candidates. Because of the huge difference in the time zone, there will be around 14 hours time difference. So that's why we are organizing it into 2 sections. So one is specifically for the Indian timing, and the other one is specifically for the Canadian timing.
Sir, just before you told that you are giving the training to the students. So are you giving the training through the online, or should we come to your center?
No. It is completely online. So we have the students all over the world at the moment. So they are from India, from Pakistan, Nepal, from Middle East, from Canada, US, UK, and all over the world. The candidates are there. So they are getting the training for this Australian examination, that is the OPRA exam, and also they are getting the training for the PBC, that is the Canadian PBC exam. So it is completely online. It's a online classes. So what we are doing is, so we'll be working in the morning in the hospital, and after coming back in the evening, we are taking the classes to the students. And here you can see Rakesh Khan. Rakesh is one of my students. So he cleared the CAPS examination. So he's also one of my students who cleared the CAPS examination. From
yes, sir. And I'm the alumni of Guru Gobind Singh College of Pharmacy, and as well as alumni of Elite Expertise. And very soon I am migrating to Australia.
Yeah. Rakesh is one of our students, and yeah, he's a very proactive candidate in the group as well while he was studying.
Thank you, sir.
So do you have any NAPLEX course or classes?
Yeah. So we are starting the NAPLEX from January. So we are starting the NAPLEX classes for the US.
Thank you, sir.
Yeah. Any further questions?
सर जैसे आप पीईबीसी की वर्कशॉप कर रहे हैं, एक वर्कशॉप पीटी के लिए भी कंडक्ट कीजिए, क्योंकि बहुत सारे बच्चों के क्वेश्चंस होते हैं कि पीटी कैप्स का एग्जाम, ओपरा एग्जाम क्वालिफाई हो जाता है और इंग्लिश में बच्चे रह जाते हैं. एक ऐसी वर्कशॉप भी कंडक्ट कीजिए प्लीज कोई.
Okay, Rakesh, sure, definitely. Like I guess the team members, they are organizing, they are working out on it to conduct a workshop on the English language test, that is the Pearson test. So I guess by the end of this month, so they are going to organize a workshop on the Pearson test. So in this workshop, like they are going to discuss about how or what are the components that are present in the Pearson test of English, like in listening, reading, speaking, and writing. So what are the 4 components? And because when it comes to the IELTS and PT Pearson test, so this Pearson test of English is completely computer based. So we need to know that how we need to answer the questions. Okay, so it is not, as it is completely computer based, and we will do the speaking as well in computer, and the computer will do the assessment, and the computer will give the score to us. Okay? So we need to know some few tips and tricks how to crack this exam, because it is completely computer based. And as our team, they are working out on it, and I guess on 30th of this month, so they are going to organize a workshop on Pearson test of English for all the candidates, those who are planning to migrate to Australia and for Canada. Even now, the good news is even Canada immigration, even for the Canada immigration, they are accepting the Pearson test of English, that is the core. So there will be 2 types of the Pearson, PTE. So PTE core is acceptable for Canada immigration, which means that it becomes much easy for the candidates. Like till 2 years back, Canada used to accept only IELTS, and the candidates would need to attend appear only IELTS exam in order to in order to get the points and in order to migrate to Canada. But now Canada also started accepting this Pearson test of English. So when it comes to the Pearson test of English, in case if you score 6 bands in IELTS, then you can score 7, equivalent to 7 in PT. If you can score 7 in IELTS, then you can score up to 8 in PT. So PT is much easier. And as we are going to conduct a webinar on by the end of this month.
Thank you, sir.
Yeah, thanks, Rakesh. Any further questions? If you would like to ask me, then please ask. I will be here for you to answer all the queries.
Sir, is PT acceptable in US universities?
Universities, as few universities, they will accept the PTE academic. Okay, so but at first you need to check with the university, so whether which university is accepting. So at first we need to check with the university as well. But there are many universities that are accepting the PTE academics in US. Any further questions, guys?
सर आई थिंक सबके डाउट्स अच्छे से क्लियर कर दिए हैं आपने सब। हम ये हमारा जो आज का सेशन है अब तक का सबसे इंटरेक्टिव सेशन रहा है।
Thanks, ma'am. Thank you so much. And special thanks to you and to all the other members of IPGA Women Forum for organizing this event, ma'am.
Thank you, sir. Thank you so much.
So, any further questions, guys? Or if you don't have any further questions, then we can conclude this session.
Yes, sir. Let us conclude the session.
Okay, ma'am. So first of all, I would like to give a special thanks to Dr. Deependra Singh, who is the Chairman, Education Regulating Committee of the Pharmacy Council of India. And my thanks to IPGA Women Forum, Dr. Geeta ma'am, who is here with us, and to Dr. Ramanpreet, to Dr. Vandana Gaj, and to Dr. Manju Singh. So we could able to reach out to all the candidates, and we could able to clear their doubts, and we could able to we could able to provide a good basic information to the candidates who are planning to migrate to overseas and to become a pharmacist, or which career that they need to follow. So these are all the things that we could able to do it today only because of your support. So your support, it really helped us, and also to all the candidates, those who have attended this event and those who are watching live on YouTube. So I would like to say thanks to all the members.
Thank you, sir.
And also for those who are watching this event live on YouTube, so thanks for attending this event. And in case if you have any further questions from your side, please don't hesitate to ask us. So visit to our website, Elite Expertise, so www.eliteexpertise. So if you visit to our website, then in the website itself, you will have a number of options. So from there, you can ask the questions, or visit to our YouTube channel. We also have the YouTube channel, Elite Expertise YouTube channel. On Elite Expertise YouTube channel, we keep on releasing a very informative videos. So weekly 2 or 3 videos will be released on Elite Expertise YouTube channel. So like how the scenarios are in Australia, in Canada, regarding the US and so on. So you can get the information from our Elite Expertise YouTube channel. And please follow us on Facebook and our Instagram. And also you guys can send a you guys can send a request to me on my professional LinkedIn, and you all can be connected with me on LinkedIn, and we'll keep on sharing a very good information to you regarding how to get settled as a pharmacist in Western countries. Okay. So once again, I would like to thank to everyone, and thank you so much, Geeta ma'am.
Thank you, sir. On behalf of IPGA Women Forum and Guru Gobind Singh College of Pharmacy, Yamunanagar, Haryana, I would like to extend my heartfelt gratitude to all the dignitaries and participants for joining us today for the webinar on global career opportunities for pharmacists. First and foremost, I would like to express my sincere thanks to our esteemed chief guest, Dr. Dipendra Singh sir, for sparing his valuable time and sharing his valuable insights and unwavering support. Sir, your presence is truly elevated the event. I also would like to thank our distinguished speaker, Mr. Arif Mohammed sir, for sharing his wealth of knowledge and guiding our young pharmacists toward global career opportunities. Sir, your contribution have been invaluable in shaping the aspiration of many of the young pharmacists.
Thank you so much, ma'am.
My gratitude goes to our IPGA Women Forum team, Dr. Manju Singh ma'am, Dr. Vannagar ma'am, Dr. Ramanpreet Walia ma'am, and all the organizer committee members from Elite Expertise for their dedication in making this event a reality. A special thanks to Dr. Anjali Sharma, who has wonderfully moderated today's event. And finally, my heartfelt thanks to all the attendees for joining us today on YouTube and Zoom. So thank you so much.
Thank you, ma'am.
Thank you.
Rakesh, would you like to share any QR codes for the participants in case if they want to visit our YouTube channel or?
Yes, sir. Ashish, please share our QR codes. अगर किसी का इस सेशन में कोई भी डाउट हो तो हमारे व्हाट्सएप कॉन्टेक्ट नंबर चैट बॉक्स में भी हैं, आप हमें कॉन्टेक्ट कर सकते हैं कभी भी. डेफिनेटली वी विल रिवर्ट यू एंड वी डू प्रोफेशनल ट्रेनिंग फॉर पीईबीसी ओपरा एग्जाम. एंड अगर आपका कोई भी क्वेश्चन है तो आप डेफिनेटली आप हमसे पूछ सकते हैं. अगर आप चाहते हैं कि एक स्पेशल इवेंट इसी तरीके का डेडिकेटेड आपके कॉलेज के लिए हम लोग परफॉर्म करें तो वी आर रेडी टू do all that as well. And this is the YouTube QR code of our YouTube channel. Please इसको सब्सक्राइब कीजिए. इसमें हम आपको मैक्सिमम इंफॉर्मेशन देंगे जो आपको आपका फार्मास्यूटिकल करियर में डिसीजन लेने में हेल्प करेगी. एंड नेक्स्ट QR कोड प्लीज. एंड दिस इज आवर इंस्टाग्राम एंड आप इसको भी फॉलो कीजिए. इंस्टाग्राम पे भी हम छोटी छोटी रील्स के अंदर जो है आपको बहुत सारी इंफॉर्मेशन देते हैं. एंड नेक्स्ट QR कोड प्लीज. and this is our Facebook, and we have a separate community on Facebook, and जिसमें हम आपको जितने भी अपडेट्स हैं, जो ओपनिंग्स हैं वहाँ पे, जैसे ओपरा का एग्जाम, कैप्स का एग्जाम क्वालिफाई करने के बाद जो ओपनिंग्स होती हैं वहाँ के बारे में भी हम ब्रीफिंग देते हैं इस फेसबुक कम्युनिटी में। आप उसको भी ज्वाइन कर सकते हैं। सर का पर्सनल लिंक्डइन आप उसको भी ज्वाइन कीजिए, सर को फॉलो कीजिए, और डेफिनेटली सर आपको जितने भी अपडेट्स होते हैं पीईबीसी ओपरा एग्जाम के रिगार्डिंग आप सबको सब मिलेंगे वहाँ पे। और ये हमारा सेशन यूट्यूब पे भी रिकॉर्डिंग में अवेलेबल रहेगा, तो आप जो लोग इसको ऑनलाइन नहीं देख पाए हैं वो इसको यूट्यूब पर रिकॉर्डेड सेशन भी देख सकते हैं। यूट्यूब जो है हमारे, जो इलाइट एक्सपर्टाइज का यूट्यूब चैनल है, ये वहाँ पर अवेलेबल रहेगा। थैंक यू सर।
Thank you, Rakesh.
Thanks, Rakesh.
Your
Yeah.
tireless
Thanks, ma'am.
efforts.
Thank you once again, IPGA and especially Geeta ma'am, and thank you Arif sir for conducting this valuable session.
Thanks, Rakesh. Thank you so much. Yeah, thank you.
Ashutosh, you can wind up the session. Thank you.